co-occurring disorders with borderline personality disorder, BPD, connection between BPD and psychotic disorders like schizophrenia. Borderline personality disorder, BPD, is a complex mental health condition characterized by emotional instability, impulsivity, intense interpersonal relationships, and a persistent fear of abandonment. Individuals with BPD often experience severe mood swings, difficulty regulating emotions, and a fragile sense of identity. While BPD is primarily considered a personality disorder, it can often co-occur with other mental health conditions, including psychotic disorders like schizophrenia. In this episode of the Borderline Personality Disorder, BPD, podcast, we will explore the connection between BPD and psychotic disorders, focusing on schizophrenia. We will examine how these disorders overlap, how they differ, and how the co-occurrence of BPD and psychosis complicates diagnosis and treatment. Understanding schizophrenia and psychotic symptoms. Before exploring the connection between BPD and schizophrenia, it's essential to understand what schizophrenia is and how it manifests. Schizophrenia is a severe psychotic disorder characterized by disturbances in thinking, perception, and emotional regulation. The core symptoms of schizophrenia include 1. Hallucinations, perceptions that occur without an external stimulus, such as hearing voices or seeing things that aren't there. 2. Delusions, false beliefs that are resistant to reasoning or contrary evidence, such as believing that one is being persecuted or controlled by external forces. 3. Disorganized thinking, difficulty organizing thoughts or connecting ideas logically, which can affect speech and comprehension. 4. Negative symptoms, a decrease in the ability to experience emotions, express motivation, or engage in goal-directed activities. Schizophrenia often leads to significant impairment in social, occupational, and personal functioning, and treatment typically involves a combination of antipsychotic medications and psychosocial therapies. How BPD and schizophrenia can co-occur. While borderline personality disorder, BPD, and schizophrenia are distinct conditions, they share certain features, which can sometimes lead to confusion in diagnosis. Additionally, the presence of both disorders in an individual, referred to as co-occurrence or comorbidity, can complicate the treatment process. Here's how the two conditions can overlap. 1. Psychotic-like symptoms in BPD. One of the key features of BPD is the experience of psychotic-like symptoms, particularly during times of emotional stress. These symptoms are often transient and do not meet the criteria for a full psychotic disorder, but they can include paranoia. Individuals with BPD may experience irrational fears that others are trying to harm them, leading to feelings of suspicion or mistrust. This can sometimes resemble delusions in psychotic disorders. Dissociation. Some individuals with BPD may experience dissociative symptoms, such as feeling detached from their own body or reality, which can mimic certain disorganized thinking or hallucinations. Transient psychotic episodes. During periods of extreme emotional distress or conflict, individuals with BPD may experience brief, psychotic-like episodes, which may include hearing voices or feeling like they are out of touch with reality. These symptoms are generally short-lived and tied to the emotional state, unlike the persistent psychosis seen in schizophrenia. While these symptoms may seem similar to schizophrenia, they are typically less persistent and are usually tied to extreme emotional states or interpersonal stressors. 2. Overlapping risk factors. There are shared biological, psychological, and environmental risk factors that may contribute to the development of both BPD and schizophrenia. Genetic factors. Both BPD and schizophrenia have a genetic component. While the genes associated with schizophrenia may differ from those linked to BPD, some family members of individuals with schizophrenia may also have relatives diagnosed with personality disorders like BPD. Trauma and childhood adversity. Both conditions are often linked to early childhood trauma, such as abuse, neglect, or severe emotional distress. Early adverse experiences can affect brain development and lead to emotional and psychological disorders in adulthood. Neurobiological factors. Studies suggest that there may be abnormalities in brain structure and neurochemical systems in individuals with both schizophrenia and BPD, although the specifics differ between the two disorders. 3. Psychotic symptoms in schizophrenia versus BPD. While schizophrenia is primarily defined by hallucinations and delusions, these features are typically persistent and unrelated to emotional states. In contrast, psychotic-like symptoms in BPD are often transient and triggered by emotional stress or interpersonal conflicts. Here are some important distinctions between the two disorders. Duration: schizophrenia's psychotic symptoms usually persist for at least 6 months, whereas psychotic-like symptoms in BPD tend to be brief and situational, usually occurring during periods of extreme emotional turmoil. Causality: in schizophrenia, psychotic symptoms are not typically linked to emotional states or stressors. In BPD, however, psychotic-like symptoms, such as paranoia or dissociation, often occur during intense emotional distress or interpersonal conflict, and may dissipate once the stressor resolves. 4. Co-occurrence of schizophrenia and BPD. Although it is less common, schizophrenia and BPD can co-occur in the same individual, creating a complex clinical picture. When both conditions are present, it can be difficult to distinguish which symptoms are attributable to BPD and which are a result of schizophrenia. Diagnosis challenges: the presence of psychotic-like symptoms in BPD can sometimes be misinterpreted as schizophrenia, leading to potential delays in the proper diagnosis and treatment. Similarly, the emotional instability and interpersonal difficulties associated with BPD can be mistaken for the emotional detachment seen in schizophrenia. Treatment complications: treatment for someone with both BPD and schizophrenia requires a multidisciplinary approach that addresses both the psychotic symptoms, with antipsychotic medications, and the emotional dysregulation and interpersonal difficulties, with DBT or CBT. Managing two serious and potentially overlapping conditions requires careful consideration of both pharmacological and therapeutic interventions. Treatment considerations for BPD and schizophrenia. When borderline personality disorder, BPD, co-occurs with schizophrenia, treatment must address both the psychotic features and the emotional regulation difficulties present in BPD. Here are some key treatment considerations. 1. Integrated approach to therapy. For individuals with both BPD and schizophrenia, therapy should integrate approaches that address emotion regulation, psychotic symptoms, and interpersonal difficulties. Dialectical behavior therapy, DBT, is effective in helping individuals with BPD develop emotion regulation skills, distress tolerance, and mindfulness. DBT can be useful in addressing the emotional instability and interpersonal difficulties while the individual receives treatment for their psychotic symptoms. Cognitive behavioral therapy, CBT, can help individuals with both conditions challenge irrational thoughts, develop coping strategies, and reduce the impact of psychotic symptoms. Family therapy may be important in helping loved ones understand the challenges of both BPD and schizophrenia, improving communication, and providing support. 2. Medication management. Medication is a cornerstone of treatment for schizophrenia, and individuals with co-occurring BPD may require medications to address both the psychotic and emotional symptoms. Antipsychotics, medications like atypical antipsychotics, for example, risperidone, olanzapine, are used to address the psychotic symptoms of schizophrenia and help stabilize mood. Antidepressants or mood stabilizers, for the depressive or mood swings that often accompany BPD, medications like SSRIs or mood stabilizers can be helpful in managing emotional instability. Careful monitoring. Close monitoring by mental health professionals is required to ensure that medications do not exacerbate symptoms of one disorder while treating the other. Conclusion. While borderline personality disorder, BPD, and schizophrenia are distinct conditions, they can sometimes co-occur, leading to a complex interplay of psychotic symptoms and emotional dysregulation. Understanding the key features of both disorders is essential for accurate diagnosis and effective treatment. Individuals with both BPD and schizophrenia require an integrated treatment approach that addresses psychotic symptoms through antipsychotic medications while also providing therapeutic support to manage emotional instability and relationship difficulties. With the right combination of medication, psychotherapy, and support, individuals with co-occurring BPD and schizophrenia can work toward greater emotional stability and improved functioning. In future episodes, we will continue to explore other co-occurring disorders with borderline personality disorder, BPD, and how to address the complexities of managing multiple conditions simultaneously. Stay tuned for more insights into BPD and its treatment.